Hello, Health 434. Welcome to my home office. Christine asked me to come in and do a brief introduction and talk to you a little bit about some of the work you'll be doing in the class. So I'll go through information, and I did consider doing a PowerPoint, and then I figured, yeah, I'll just go ahead and talk to you all as though I'm there with you, which might come out strange, but we will find out. So again, my name is Kirsten Vinther. I use she, her pronouns, and I'm the prevention specialist in health education here at Campus Health and Wellbeing. What that means basically is I work largely in prevention and in education and sometimes in tertiary treatment type work with high-risk behaviors, particularly things like alcohol and drug use, our recovery community, as well as self-harming or suicidal ideation. Who I am, and I'm going to share who I am because it really does color the lens with which I bring this information. I have been on campus for 6 years, a little over now. And where I come out of is gender and power-based violence. So I worked at RISE for many years, as well as child welfare services. So my lens is definitely geared a little bit more towards the social justice and social response to issues in our community. Here on campus, I've worked with students who volunteered locally, nationally, and internationally, both through classes and just because it was something that they did through the Center for Service in Action. Did that for several years, and then I worked my way into gender work, so Women and Gender Equity Initiatives Director for the Cross Cultural Centers. And that was really an incredible experience. I've loved all of them, but that was really a cool way to get a sense of what the culture at Cal Poly really looked like. Now, as I said, I do alcohol and drug prevention education. I head up our Mustangs for Recovery program, which is a recovery community for students who are either sober or seeking sobriety and recovery, and looking for a community to build around that. We have multiple meetings available every week if anyone wants to jump in and see what a meeting looks like. What else do I do? Oh goodness, I also oversee our peer wellness coaches, which is part of peer health education, and we'll go into a little bit about what the structure of that looks like. And our coaches do one-on-one consultations with other students. They also run some small dialogue groups. The mental health dialogue groups is one of theirs. So I supervise them, and I also do some one-on-one work with students. So I work on basics and K6, which is basically what they stand for is brief alcohol screening and intervention for college students, and also for cannabis and other drugs. And it's basically a one-on-one atmosphere where I can talk to them about their drug and alcohol use, help them figure out what their next steps are, if they need to go to an abstinence program or if they just need to kind of set some goals. So that's what my day looks like, and you will find probably as I talk about this that those lenses show up. Campus Health and Wellbeing at Cal Poly is quite an entity. Hopefully you all know where the health center is, over there by the rec center, not far from the Kinesin Health building. So hopefully you've all been there. And we house roughly 50, a little over 50 staff members. They range from psychiatrists to psychologists. We have x-ray technicians. We have lab techs, doctors, nurse practitioners, pharmacy techs, health educators, and then another probably 45 peer wellness educators. And what that looks like is Campus Health and Wellbeing is kind of split into 3 categories. We have the medical side, which is, where all the doctors are, where the walk-in clinic is, ambulatory care, x-rays, prescriptions, you name it. We have the counseling center, which includes, I think, right around 20 providers, from a psychiatrist to multiple psychologists, as well as a crisis intervention team, so that students are really getting met where they are, and they offer group therapy as well as individual and couples therapy. And then there's health education, and health education is kind of big. So we house professional staff, the professional staff who do the health education. We do the campus-wide presentations, so things like all the first years who are coming in, WOW, Slow Days, all the athletics teams, band, Quarter Plus, all the leaders, you name it. We do a lot of classroom presentations as well, so on specific topics, which we'll talk a little bit about. We do presentations to clubs and orgs. Fraternity and sorority life is a big partner when it comes to our presentations and getting that education out there. And then, as I said, we also offer basics and K6 services for more one-on-one, kind of more case management-y type work. Within our peer wellness educators program, they are broken into a series of different topics. So those topics include now gender and power-based violence, so the SAFER program, our Safe Partying team, which is commonly known as either TLC or ACOG for alcohol, cannabis, and other drugs, but their focus is really harm reduction. We have our physical health team. They will do anything from help work up a workout schedule for somebody based on their concerns, their time commitments, what their wants are and needs are. They'll work with people to build healthier eating habits. Yeah, it runs the gamut. Mental health team will oftentimes talk to people about stress. A lot of times we get a lot of people coming in with big transitions. So first year is just being away from home and getting their feet under them. We see them with about roommate issues, really anything that delves into the mental health field, but isn't necessarily something that needs to be seen by counseling services. The peers will see them. We have a sexual health team that talks about not only relational health, but also just general sexual health, STI prevention, pregnancy prevention, education around PrEP and what that is. And then, as I said, we have the recovery services, Mustangs for Recovery. We offer 4 recovery meetings a week. One is a traditional 12-step, and the remainder are open recovery meetings, so people can drop in. Now, with all of this being said, this is the structure that we had this year, right? And we have now shifted to a virtual structure, but offering many of the same services. The students also offer one-on-one consultation. So our coaching program, which I talked about early on, students will see other students on a one-on-one basis. So they may walk in crisis, they may walk in with stress, they may walk in with a specific need or a specific goal, and our coaches will sit with them, help them develop a plan, and help them kind of have almost an accountability buddy to help them move forward. So that's the structure of campus health and wellbeing, which is so much information, and I will give you my contact information at the end of this. So if you have questions or want more specifics on anything, I'm happy to answer. And so I have kind of a series of questions that Christine asked me to kind of touch on. And so I will do my best to do that. And I know you are probably getting information from Sam at the Pride Center as well. So hopefully this will round it out. Concerns that I've noticed about health and well-being being able to serve LGBTQ plus college students. I think the thing I go back to often is historical trauma memory is long. So if a student comes in who is LGBTQIA plus and has a bad experience with a medical provider or with somebody at the front desk or anything, all of that gets shared, right? And that trauma is long because it's traumatic for them, right? They are coming into and being vulnerable and asking for help. And so I think that some of what we see in campus health and well-being is that residual, is that that kind of the process of people telling stories about what has happened to them. Also, it's a challenge for us because our system that we use is not tailored to record specific needs and data. So for example, coding for correct pronouns, coding for lived name, it's limited. So students may come in once, give that information to the front desk or to a provider and have a very positive experience, but then because we're not able to code it appropriately, they may come back in and be misgendered or called by their dead name. And so that's something that we are working on, and I'll tell you a little bit at the end of this, some of the stuff that we've done this year and we'll continue to work on this year. So that can definitely have an impact. Staff is, they are receiving training all the time. And it's almost like a little city, right? And so we're meeting together and we're training and we're trying to cross-train and have an interdisciplinary approach to how we approach students and how we work with students. But as a result, it's kind of like we get this broad swath, but not a lot of depth. And for some people, that is totally fine because they will do the research and kind of dig that out on their own. But a lot of people are intimidated by that. And so there's the limited availability of kind of specific training as to how services to LGBTQ plus students may look different and considerations that we may need to have. So I think that is a limitation. As with nationally, potential biases can show up. And I think that more of that is more than a bias is a fear that the providers have that they don't have enough information to be able to serve LGBTQ plus folks appropriately. That is particularly striking with the trans and non-binary communities. So there's a lot of kind of like, I'm not against treating trans and non-binary folk, but I don't know what I need to know. I think that there's more awareness around explicit biases as well. So, kind of specific explicit language and denials of services, that sort of thing that we do see nationally. There's also implicit bias, right? And anybody who has ever experienced implicit bias, you know it when it happens and it doesn't feel good. And so it really does require a certain level of depth of training in order for medical providers to be in a position where they feel confident to be able to show up and serve in the way that they need to. I think in terms of the topic, talking about substance use as well as mental health, there's the stigma that's associated with that, right? The stigma that's associated with mental health issues or being diagnosed with a mental illness. Stigma around substance use, period, not to mention, substance abuse or being abstinent or in recovery. And all of that compounds, right? If you know a little bit, which I'm sure you do, about intersectionality, right? Those things compound upon one another and they overlay on top of one another. So I think that those biases that come up around queer folks also come up around people with substance use disorders, also come up around with people who have mental health issues. And so this kind of all lays on top and creates this foundation. And I think that nationally, we have to look at the national issues because they're known, right? And so while some of these issues may not have explicitly occurred on Cal Poly's campus, LGBTQ plus folks know certain things, right? Certain experiences that are held within the community. So queer folks have higher rates of a lot of health issues, things like diabetes, asthma, smoking, substance use, suicidal ideation, mental health issues, anxiety, depression. And I want to be real careful with that and ensure that the understanding is that much of what we see in terms of health behaviors and in terms of the health concerns that queer folks have can be linked back to trauma, right? Can be linked back to experiences throughout their lives for which they are seeking remedy. So to not confuse correlation with causation, right? I think that nationally also medical providers show significant implicit biases, particularly as they relate to patient compliance. So there's a lot of bias surrounding whether or not queer folks will be compliant with your recommendations. Patient-doctor communication, I think a lot of that is that educational piece that many medical providers don't have in terms of how to have this conversation in an open and meaningful way. 56% of queer folks have experienced discrimination in healthcare settings, including blatant refusal to treat when their identity is disclosed. To more implicit and systematic things that we've talked about, right? An inability to specify genders or names on check-in forms. So you're kind of having to write your birth certificate in rather than putting in your lived experience. And that, as you can imagine, is a triggering thing to have to step out of the person you are in order to fit into this mold of how that data is collected. 19% of trans folks have been denied healthcare explicitly because they're gender nonconforming or trans. So they are told, we cannot treat you here, which is, again, astonishingly traumatic for somebody who is feeling vulnerable who is coming in for care, which is never a fun place for any of us to be. There's also a roughly 50% of trans folks report having to explain certain aspects of transgender-specific medical necessities to their healthcare providers. So understanding why this specific HRT is important for them, or why they're asking for a specific test or a specific type of medication or treatment. And it's pretty significant, right? Because when a person experiences discrimination by a healthcare provider, they're about one-third as likely to seek out care in the following year based on need. So even if they are ill or if they feel that they could use medical care, they are far less likely to reach out for that. So all of these things kind of compound, I think, in what we find with students and their interactions, and all of these experiences kind of color what students expect to receive when they get to the health center. Some fun, exciting things, though, that are happening this year are Campus Health and Wellbeing, specifically Dr. Bobel, we have instituted HRT, or gender affirming hormonal care. So that is something that students don't have to go off site for. They can come and they can receive the care that they need. We also instituted the Gender Affirming Care Working Group. It's a multidisciplinary team. And we are really focused on creating a more inclusive environment overall. So it's not just looking at our systems and looking where we have that lack in terms of being able to record people's gender identities, being able to record people's lived names, but really that kind of implicit thing too, like how welcoming is it when you walk in the door? What do you see? Do you see yourself represented? Do you see an array of identities represented? So there's some really exciting things happening, and I've been there 2 years now, almost 2 years now, and I've seen a tremendous amount of growth in terms of the willingness and the want to create a better and safer space for students. So I hope that all of this is helpful, and I hope that my strange little background here in my home office isn't too distracting, although gotta love Frida, right? Again, if you have any questions, I am absolutely open to hearing from any of you. My direct line at work is 805-756-6619. And my email address is kvinther, VINTHER, @calpoly.edu. Christine, Julia, everybody has my contact information, so feel free to reach out if you don't get that. If you have specific questions about our recovery community, there's also an email that you can send out to recovery@calpoly.edu. Follow our Facebook, follow our Insta, and you'll get lots of different information. And I can't wait to see what you all come up with this year.